Hi, my name is Dr. Jamie Fleming. I am a pediatric anesthesiologist and interventional pain specialist at Phoenix Children's Hospital. I'm currently the section chief for the pain section, and I'm double board certified in both pain and anesthesia. The teams-based approach is so critical to treating pediatric chronic pain. Really, the thing is, pediatric patients are not just small adults. And so that in itself is very different. And the reason for that is different developmental stages. They depend a lot on their family and environment. Their activity levels can be different. How they cope emotionally is very different. Even the reasons why they have pain and their physiology is different. Yet all these things come together and really influence how they experience and recover from pain. I think the family is such a huge and critical part of their care and treatment plan. And so that's one thing that can be very different from adult medicine as well. And understandably, when families come in, they're really frightened oftentimes. They have this child with severe pain and they feel helpless. They're not sure what to do, not sure how best to treat it. And sometimes we see families where their entire life reorganizes around the child's pain. And they're trying to help their child, but really it ends up reinforcing the whole pain cycle. So a lot of this is coaching the family and helping them through these things and how to better address and respond to their child. Our approach at Phoenix Children's is multidisciplinary care. And what that means is we have a lot of different specialists involved, and we all work together to deliver one unified message to the patient. So that means we have pain medicine, we have psychology, we have physical therapy, occupational therapy. We have advanced practice providers and nurses as well. And then we have people that do integrative therapies and even interventional pain specialists like myself. Our whole MDC and multidisciplinary team really works together to give that unified message. We don't want patients going to all these specialists, getting different things from different people and getting confused and not getting a really uniform and comprehensive plan. So that's what our goal is, and that's how we work to educate and treat our patients. Really, our message to them is your pain is real, movement can be safe, and we can restore your function. So that's what our message is. And I think a good example of that is something we see frequently, and also pediatricians and other specialists will see, but complex regional pain syndrome. So this is something that comes into our clinic fairly often. And really these patients, it's a very difficult diagnosis. It's very hard on the child functionally. The family really struggles with how to help the child in these situations. And, it can be really alarming because their function can deteriorate very quickly. And it's a diagnosis that's not easily made sometimes out in the medical world. So by the time they see us, they're often very frustrated and worried. And really what we have to do in that situation is get all these modalities together in one room, explain a comprehensive plan. Really, we explain the foundation as physical therapy, pain psychology, and then we add on layers depending on the need of the patient. So oftentimes that's different types of non-opioid medications. Sometimes we even do things like injections to help them participate in their therapies. I think one big thing to know is our goal is not lowering a pain number. And that sometimes sounds different to adult medicine as well. And our goal is really to restore that child's function, and that functional outcome is really what matters.